Hello, I'm Dr. Soe from Department of ONG and Unicare RCMP. Today, I would like to demonstrate how to take the endometrial sampling with the people cannula without anesthesia. Before explanation of the procedure, I would like to explain about the indication of endometrial sampling. One is the abnormal uterine bleeding over the age of 45 years. The next one is the medical failure in the heavy menstrual bleeding patient. And number 3 is the postmenopausal women, the abdominal thickening is more than 4 millimeter. And another one is the subfertility patient and post-polycystic ovarian syndrome patient. So the timing of the endometrial sampling is first day of the menstruation for the abnormal uterine bleeding and office visit for the postmenopausal women and the premenstrual phase for the subfertility patient. First, you introduce with your patient and explain the procedure and take the consent. Then call your chaperone and the patient in the dorsal and recumbent position. Then flex the hip joint and the knee joint. Then the abduction of the legs. So that is the position for your procedure. These are the instruments to prepare for the procedure. This instrument is a sponge folder to clean the female perineum. And this one is a thin speculum to just express the posterior vaginal wall. If you don't want to use this thin speculum, you can use the cascode bivalve self-retaining speculum. This one is the forceps to grasp the anterior lip of the cervix in the procedure. And these are the contour wall for cleaning of the female perineum. And this one is people cannula to take the endometrial sampling. And this one is the examination form, and this is a formalin containing bottle to collect the specimen. First, you just clean the female perineum with use the gauze and antiseptic solution. Then up and down medial to the lateral part of the perineal region. And take another gauze and antiseptic solution and clean medial up and down to the lateral. After cleaning, you just drop it the starlight towel, upper towel, and then you just use the vaginal examination to assess the uterine size, position, mobility, cervical condition, and nasal mass. Then you can use the thin speculum. So you just insert the thin speculum parallel with the vaginal wall and rotate and depress the posterior vaginal wall. So you can clearly see the cervix, and then you use the false alarm, and then just grab the anterior lip of the cervix. Then use the people cannula, insert through the vagina, cervix, and uterine cavity. If you don't want to use the thin speculum, you can use the cascode bivalve speculum and insert the same procedure as a thin speculum parallel to the labia minora and rotate inside the vagina and open the valve and fix the screw so you can see the cervix and cervical canal clearly. Okay. After you create the vacuole, then you hold the outer tube and pull up and down for the 2 to 3 times and spontaneously rotate along the uterine cavity. So the tissue will become into the cannula through the opening. Now that you already collect the adequate specimen, then you just release the false alarm from the patient and also release the syn speculum from the patient gently. So now that you just cut the tip of the paper cannula and push back the specimen into the formalin container by the pushing of the plunger. So you can get adequate tissue specimen inside the bottle. Then you just close and then fill up the form for the investigation and write the patient name and IC number on the formalin container and send to the lab for histopathological examination. Okay, this procedure complications is only the bleeding and pain to the patient. Therefore, you can prescribe the tranexamic acid and painkiller analgesics to the patient. The perforation of the uterus is very rare for this procedure because we use the plastic cannula. Thank you for watching my video.